let's roll over to health headlines. We're talking about the fast-spreading disease Ebola. Worldwide, the virus has infected more than 3,500 people and killed more than 1,900 of them, making it the largest outbreak in history. Joining us to talk about it today, New Hampshire Public Health Director Jose Montero. I think a lot of people have heard the word Ebola. They know to be frightened of it, but they don't really know exactly what we're talking about here.
Well, Ebola is a viral illness that has been present in Africa for quite some time. We have seen outbreaks around 40 years or so. The symptoms are quite common as any other virus. It starts with fever, muscle aches, joint pains, but it evolves to having hemorrhagic internal and external findings of bleeding. It's a disease that you acquire by the direct contact with the secretions of somebody who has symptoms. So it's not casually acquired, and that's an important piece to remember.
And you might start out just not feeling well, like you're sick, but if it progresses, you need to watch it closely then.
Correct.
And where is the outbreak happening these days?
Western Africa. We have New Guinea and 3-4 more countries. This is unusual. Normally it has been Central Africa, and this is part of the changes that we're seeing in the virus and why there is so much international attention. There are too many cases. The initial planners and responders didn't expect it to grow this much, so that is why the U.S. and the Center for Disease Control and other international organizations are providing a lot of support.
Is there a concern that the outbreak will happen here in the United States?
It is quite unlikely. We have a whole different infrastructure of care. Cases, we may have a few that may be imported at any given time. We don't expect that to happen, but it can happen. But the spread has been around healthcare. Our healthcare infrastructure is way different. We have a lot of measures in place to prevent that.
And what is New Hampshire doing to prepare?
We have been connected with CDC, tracking the disease, making sure that we are providing education to our physicians, so we are sure that they are up to the last measures for control in case that a patient is identified here. We are working as well in doing education to the public and having materials in place for that.
Certainly no need to panic here then. We're watching it.
We're watching it. It is unlikely. It is unlikely. We keep track of people who may be at risk coming from overseas, and we will keep people informed.
All right, Dr. Jose Montero, thank you.
Thank you very much.